Hi, Jim Murphy for Elite Style Massage. So a video today just giving you my thoughts on the steroid injections and nerve block injections that you might get referred to for pain in a knee or an elbow. They're not the same as anabolic steroids. They're a hydrocortisone steroid, which is actually the reverse of what an anabolic steroid does. So if you've got any pain or inflammation in a joint, like a knee or an elbow, they can be really useful. So I'm just going to start by saying I'm not medically trained, so I'm not medically qualified to give you advice on these things. But what I am qualified to give you some advice in and thoughts on my experience with these things over the last 30 years of being in this industry. So I've been a gym owner for an 18-year period. I've owned 3 gyms and been a personal trainer. And now I've been a soft tissue therapist since 2006. So 30 years in total. And I've come across so many people that have had steroid injections because of sport, certain injuries and stuff like that. So they've been quite common over the years for me. And I've just kind of seen a pattern with people, that how they get on with them. I've had 4 lots of steroid injections over the last probably 10, 11 years. I've got a lumbar disc issue, so I've had 3 lots in my back. I've had 1 lot most recently in my knee. The 3 in my back were actually quite effective. I got about 7 weeks relief from 1 lot, and then I think the other 2 weren't quite as effective. But when they do my steroid injections for my back, for a bulging disc and prolapse disc, it's more as a diagnostic test, because they want to see if they get relief in that area, and if they do, they know that it's those nerves causing the problem. Then they go on to do ablation or nerve block injections, which have been amazing, because I've had 15 months relief out of 1 lot of those. Now that's a good bit of relief for a minimally invasive procedure. Anyway, getting back to the hydrocortisone steroid injections. Now, if you've had pain in the knee or an elbow problem or wrist problem even, any joint can get problems, and they normally refer you for physiotherapy first, which most people will try. And if you don't get great results, they might look at pain relief with things like naproxen or anti-inflammatory drugs, and they're NSAID drugs, non-steroidal anti-inflammatory drugs is what they'll give you. They like Nurofen and Cuprofen and those sorts of things. And you may get on all right with them, you may not. But if it's still not giving you the desired effect, then they might look at referring you for a steroid injection or steroid injections. So in my experience of being a gym owner and what I've had personally, I know you can get side effects and adverse effects with any medication. But in my experience, they'll either work and you'll get less pain and increased movement, or they won't work. There's no in between. Me personally, like I said, they've worked on 3 occasions and not really on the 4th. But I've never come across anyone that's come back and said, oh, I had redness or swelling. Bruising is another thing. If you get an injection, you can get a little bit of bruising anywhere, but no adverse effect. You know, if you look at they give you a list of the side effects, give you a pamphlet on side effects that can happen. They are in very rare cases on most of them. So like I said, if you have been referred for a steroid injection and you're a little bit worried about it, or you've maybe Googled it and it's maybe stressed you out a little bit, I would personally say not to worry. If you're the kind of person that gets side effects or adverse effects from anything, even like a headache tablet, then you may want to speak to your pain clinic and just see what they say if you're a little bit more sensitive to these things. But like I said, I've never had anyone that's had a problem. Like I said, it's either helped or hasn't helped. And with my back injury that I've had for many years, they do the steroid injections first, get the relief that I'm looking for from that for a certain amount of time, then they book me in for my nerve block injections. Now the ablation or nerve block injections, where they go in and they just kill the end of the nerve, it's not permanent because it does come back, and like I said, I got 15 months relief out of that. Can be a bit of a painful procedure at the time, but if it's 4 minutes of pain, maybe 3 minutes of pain for 15 months relief from what is normally quite a painful thing in my back with this bulging disc that I've got, I'll take that. It can be really useful. So if you've tried all else and you're not really getting anywhere with it, and it's interfering with your sport or your training or your work even, or even your daily life, this is the next step normally they move you on to pre-surgery. Surgery is always the last resort. They'll normally do various tests when they send you for physio to see whether it is serious enough for any kind of surgical intervention. But a lot of the cases it isn't. It's just a small problem in the joint. There's lots of things that can happen. I don't want to get too much into the mechanics of it now in this video, but just a small bit of advice for you with regard to these things, just in my personal experience, where if you have been recommended to them and you've tried all else, I would go for it. Like I said, you've got nothing to lose other than pain. And I'll take that definitely. So again, just a little bit of information again for you guys. Hopefully you're liking these videos. I'm going to try and do a few more topics over the next few sort of weeks and months to do the things I come across most common. But I thought I'd just drop this one in there because it is something that's come up. I'm just trying to think of things that I come across and have come across over the last sort of 30 years in this industry. And I did actually think, oh, steroid injections and nerve block injections. Because I had someone recently at my gym that got referred for actually steroid injections in his back, and he couldn't believe it. Literally instant, he got in there, had the steroid injections, and come out, and he goes, my back's been amazing. He said, I can't believe it. It worked instantly. Like the next day, it was great. It just depends how long you get out of these things. I know years ago, like years and years ago, I'm going back many, many years, they used to say you was only ever allowed 3 steroid injections in your life. Then they changed it to saying you can have, I think it's 3 in a year you can have, they used to say. But now they're saying you can have as many as many as you need. I think as long as they're giving you relief for a certain amount of time, then it's something you could use. So, definitely worth looking into. So hopefully you're enjoying my videos. If you can like and subscribe, that would be amazing. And hopefully I'll see you next time.